Adrienne Stirrup, Director of Austin Public Health, joins us now. Adrienne, thanks so much for being with us.
Thank you for having me.
So we'll talk specifics about the budget cuts in just a moment. But first, the concept of public health sort of became controversial or even politicized during the COVID pandemic. So can you please remind us of the overall purpose of the many public health programs and the services your department provides?
Thank you for that. My predecessor used to say that public health is kind of like air. You don't really know you need it and how much you appreciate it until you don't have it. And so in public health, we're all about population health outcomes. And that means working with community to ensure health. So we're everything from immunizations, and that's not just COVID. We do all childhood immunizations. We do flu, we do pneumonia. We have WIC clinics, so that's about helping moms and babies have a healthy start in life. We do neighborhood services, places where people can come and get important health screenings so that they can have information and be able to take good charge of their health. We support food pantries. We have employment support. So all of those factors that really drive health outcomes, those things that happen outside of the doctor's office, that's where public health is. We're also out at your favorite food trucks or restaurants, making sure that our food is safe. We inspect pools. We test mosquitoes to check for West Nile. We track down all the bad diseases that try to make their way into Travis County. Right now, there's a team of staff tracking down any suspected measles case so that we can be on it and keeping the public and our elected officials informed. If there's Ebola, we're working across different jurisdictions and partners just to make sure that we're keeping our eyes and ears open to protect the public health and safety.
From years of COVID, now measles, public health officials really have not appeared to get a break lately. And now as for those budget cuts, who will be most directly impacted by these cuts?
Our entire community. Public health is not just about a specific population. A lot of times people get confused and think that public health is really about health care for the uninsured. But as I said, it's really about population health outcomes. It's that disease surveillance, and that just means disease tracking, it's infection control, it's food safety, it's all the illnesses and things that can affect anyone, no matter where you look, how you look rather, where you work. Public health is really about community safety. And so when we make cuts to public health, our entire community is at risk.
And that being said, can you elaborate with these potential cutbacks? What do you foresee as being the most serious risks for the low-income communities and families that you directly help, as well as for the community at large?
So public health is a safety net population, or the safety net of community. And I will just focus on our immunization clinics to try to simplify it. We provide free or low-cost immunizations to community members. So again, during COVID, it was COVID. During Mpox, it was Mpox. Right now, we're focused on measles, but it's everything from flu to all of the things that we've come to appreciate and the science says protects us from communicable disease. If we're unable to provide those services, that means one, there's strain on the rest of the healthcare system, right? Because we know that it's important. We learned that from COVID, that idea of being your brother's keeper. So if we keep all of our communities safe and protected from disease, it minimizes the chance of risk, the chance of spread throughout the community. And so again, the initial focus is on those historically marginalized or low-income communities that rely on us for those free or low-cost services. But if we can't do a good job at controlling disease spread, that is going to be an impact to our entire community.
Undoubtedly, definitely sounds like a challenging time for public health right now. Once again, that's Adrienne Stirrup, Director of Austin Public Health. Adrienne, thank you so much for taking the time and breaking this down with us.
You're welcome. Thank you.
Thanks so much for watching. Be sure to like and subscribe and leave us a comment below to let us know your thoughts on this video. And don't forget, you can watch full episodes of Austin Insight for free in the PBS app.